Our group, Katie Mason, Allison Lycan, Chris Bertelsman, and Nicole Upchurch, researched the details of prison healthcare, including what it is, the history, the population eligibility, and the strengths and weaknesses of the system. So what exactly is prison healthcare? In a prison system is a necessity to have an organized healthcare system, much like it's a necessity in the government system. United States has similar healthcare systems for both the prison and government. However, there are some key differences between the two. The freedom of choice for healthcare seen in citizens of the United States is absent in the incarcerated population, while today the prison healthcare system is required to give emergency medical care and necessary medical care for chronic diseases such as diabetes and heart disease. This has not always been the case. In 1976, the Supreme Court ruled all prison healthcare systems had to provide healthcare to all inmates. This was put into place to protect the rights of the incarcerated and to secure their protection under the Constitution. Even with necessary emergency medical treatment provided, up to 2 years of life are lost every 1 year spent in prison. Along with this, many prisoners didn't receive a medical exam while incarcerated, including 68% of local jail inmates, 20% of state prison inmates, and 14% of federal prison inmates, a 2009 study published in the American Journal of Public Health found. The obstacle of copay exists both in government and prison systems of healthcare. For 35 states, inmates are required to pay a copay to receive healthcare. This is a bigger obstacle for inmates than free citizens due to less opportunity to obtain a salary in prison and the absence of Medicare and Medicaid in prison. If inmates are working a job, most make below minimum wage, sometimes even only 12 cents an hour. While these copays are put into place to prevent inmates from abusing healthcare, they end up increasing the cost of healthcare because inmates do not seek preventative treatment, but yet wait till they are too far along and only can be able to seek curative treatment.
We'll now be going over what led to modern prison healthcare. In this, we'll be going over the political, social, and economic factors that led to where we currently are with prison healthcare.
Prison reform began in the 1970s with widespread federal court interventions after investigations revealed that inadequate health services were a mass issue in prisons across the country. After this, the AMA began working on creating a program that could fix these inadequacies. In 1975, the Department of Justice's Law Enforcement Assistance Administration funded the AMA's jail program. The program was a development of stricter standards for health services in jails to follow, forming the nation's first accreditation program for correctional facilities. In 1976, the AMA held the first national conference on improved medical care and health services in jails. This allowed for greater public awareness about the issues surrounding the healthcare of prisoners. Following the success of the pilot program and the increased awareness of the problems in prison healthcare, the AMA published their first set of official health standards for prisons and juvenile confinement institutions. The publishing of these new health standards was followed by other institutions adopting their own programs for prison healthcare reform, leading to a larger push by not only a single organization, but a strong national one. However, with these changes in prison healthcare reform also came social and political debates on whether there should be quality care for prisoners. The main debate stems from the argument that prisoners are being provided food, shelter, clothing, and now healthcare by the government through the expenditure of citizens' tax dollars. To further what some felt as an injustice, there are free citizens in the United States that are not able to afford any of these, while still never having committed a crime. The counter-argument to this is that others believe that a prisoner has no options on their health care and is ultimately at the mercy of the state as to what sort of care they can receive. A free person has the right to health care or not, depending on how they prioritize their money and whether or not they're able to afford it. This other side of the argument can be strengthened by the fact that there are government assistance programs such as Medicare and Medicaid for those who are not able to afford health care. Politically, many of the debates against prison health care were suppressed by the 1976 Supreme Court case of Estelle v. Gamble. This court case ultimately ruled that deprivation of health care and malpractice was a violation of the Eighth Amendment, being deemed cruel and unusual punishment. This not only strengthened the prison health care reform movement, but also gave prisoners a legal right to health care. Eventually, the AMA's program evolved into the National Commission on Correctional Health Care, also known as the NCCHC. This organization is a non-profit whose focus is on quality and regulations of prison healthcare, and is still pushing for future prison healthcare reform to this day.
Population eligibility regarding prison health care takes into consideration the population that it serves, as well as what factors come into play that affect that eligibility. The population served is prisoners, which means people who have been admitted to prison, jail, or a correctional facility. Prisoners' eligibility for prison health care can vary, especially by state. There are certain statutory regulations that need to be followed, and these can be in combination with standards that are set forth by that state's Department of Corrections. Accessible services goes hand in hand with prisoner eligibility. A factor that affects both of these is the health status of the prisoner going into prison. If the prisoner's health status is poor, they're suffering from severe or moderate illnesses, conditions, they'll require special care, and that access is harder to achieve, especially since it requires the aid of a prison guard escort. And the one problem with using a prison guard escort is, of course, the driving factor of prison health care, which is money. Money plays a big role in prison health care eligibility. General care, prescribed medication, and screenings are provided for free, but other services such as specialty care or unprescribed medication does require a copay, which can range from $4 to $20. The prisoner who is probably is unemployed or receives payment below minimum wage or is not insured will have a hard time paying for these services. In this case, the healthcare administration will require the prisoner to pay the copay once they have the money in the future, or will turn to the family or relatives of that prisoner to carry the financial burden. Medicaid can play a role, but for those who have Medicaid before going into prison, Medicaid will only cover inpatient hospital services that are provided outside of the prison. So it's very specific and it doesn't cover a lot. So basically, for prisoners who want optimal care, they must go into prison with the money to cover for those services. Assuming a prisoner has money to afford healthcare services and is eligible to receive this care, there are certain procedures that must be followed to navigate the healthcare system and get the necessary services, and these procedures must be followed in a specific order. A study was done in Louisiana on how a prisoner navigates the prison healthcare system, and it was found that basic healthcare needs are treated by emergency medical technicians. They also determine who is eligible for higher specialty care. This higher specialty care may or may not be provided by a healthcare physician. Also navigating the prison healthcare system, there's the problem with transportation. If services are off-site, then that lowers the chance of navigating to get the proper care because transportation costs money. So it is possible to navigate the prison healthcare system, but the actuality of it is that a prisoner will probably not be able to do it successfully.
Like any other system in the country, there are both strengths and weaknesses that make it the way it is. When a system has more strengths than weaknesses, it is likely that the system's going to run more smoothly. Unfortunately, in prison healthcare, the weaknesses of the systems outweigh the strengths by more than they should, and the people in these prisons have to pay the price for it. According to Estelle v. Gamble, in 1976, the Supreme Court ruled that all prisoners are entitled to adequate medical care. While this may sound like a strength, the medical care they are given is extremely poor and make it almost impossible for prisoners to receive the care they need because of the cost. All the individuals that are receiving this health care continue to struggle with lack of medical examinations and prescriptions for medicines that they need to survive. Not only do they suffer trying to get the proper medical care, paying for the actual visit can be extremely difficult depending on funds they have in their commissary account. A standard copay for a normal checkup can range from $20 to $100. Having to pay this price every time they are sick can be an extreme burden to the prisoner's commissary account, especially since the minimum wage for most prisoners is 12 cents per hour. Having such high copays for inmates is a weak point of the system. Prisoners pay more than they can afford, and yet the copay has little effect on the budget of the healthcare for the state facilities. The inmates' copays serve as a financial burden with only marginal benefit. Another weakness in the system is that more and more prisons are becoming privatized. This graph of the United States shows how many private prisons there are in each state. The darkest blue means that more than 30% of the prisons in that state are private. As the colors start to fade, it means that there are less private prisons. The thing about private prisons is that while this might seem like a strength because of its cost-cutting measure, becoming privatized means that the state does not have to pay benefits and pensions to the workers, causing the overall quality of the care to decrease. If states start to have this kind of care in all their prisons, they are going to end up spending more money because the medical problems will not be fixed right away. The longer they wait out medical problems, the worse the prisoners are going to get. This will lead to the medical treatments being a lot more expensive, causing the state to have to pay more.